How to stop cavity pain. Cavities are a form of tooth decay in your mouth. Left untreated, cavities can lead to more severe tooth problems, such as tooth pain. If you are experiencing a toothache due to cavities, you can learn how to relieve the pain. Method 1. Stopping cavity pain medically. 1. See your dentist. One way to get rid of cavity pain is to go to the dentist. Your dentist will do an exam and get X-rays of your teeth to see where any cavities or other tooth or gum problems are. Then, your dentist will suggest the best course of treatment for your cavity. The most common treatment for cavities is a filling. If the tooth is infected or abscessed, your dentist may prescribe antibiotics first to clear up any infection, which is important to avoid any further complications. 2. Take over-the-counter medication. If your tooth or gum aches because of a cavity, taking over-the-counter pain relievers may help reduce the pain. You can take ibuprofen, Advil, acetaminophen, Tylenol, naproxen, Aleve, or aspirin. Follow the dosage instructions on the label. Make sure not to let aspirin dissolve on the tooth or gum. This may harm your mouth and teeth. 3. Try numbing gels. You can try numbing gels around the area of the cavity to help stop the pain temporarily. Numbing gels contain benzocaine. You should spread the gel on your gums with either your finger or a cotton swab. Make sure you don't swallow the gel. Spit out the gel left in your mouth. Read and follow the instructions on the box or tube to know the amount of gel to apply and how often you should apply the gel. Keep in mind that if your saliva flow increases after you have applied the gel, that is absolutely normal. Your tongue may also go numb for a while, so you may want to avoid talking for a while or you may bite your tongue accidentally. Method 2. Using home remedies to stop cavity pain. 1. Clean out the cavity. You may be experiencing pain in your cavity after you eat. This might be due to food being stuck in the cavity. To help relieve the pain, rinse your mouth with warm water. Then, use a toothpick to gently and carefully get any food out of the cavity. Make sure not to poke too deep into the cavity because you could cause more damage to the tooth or gums. 2. Make a saltwater rinse. Rinsing your mouth with warm salt water is one of the most effective ways to help reduce pain in the mouth. Salt water can help reduce acids in your gums, which may be leading to irritation and pain. Stir in a tablespoon of salt into a glass of warm or lukewarm water until dissolved. Rinse with the solution, making sure to swish it around the sore gum and tooth. 3. Use an ice pack. Another way to help cavity pain is to use an ice pack. Place some ice cubes or crushed ice into a towel, balloon, or the cut-off finger of a non-latex glove to make an ice pack. Place the ice pack on the tooth if it isn't sensitive to cold. You can also place the ice pack on your face just over the painful area. You can also use an ice pack that you buy in the store instead of making one yourself. Make sure that you wrap the ice pack in a cloth or paper towel before you use it. You can leave the ice pack on for about 10 to 15 minutes. Then, remove it and give your skin a chance to return to its normal temperature. 4. Swish with hydrogen peroxide. Hydrogen peroxide can help remove bacteria in the cavity and clean the area to help reduce infection. Swish your mouth with a 3% solution of hydrogen peroxide. Keep it in your mouth for up to a minute. Spit it out and make sure not to swallow this solution. Avoid using hydrogen peroxide solution for more than 5 days in a row or your teeth will get sensitive. Method 3. Trying natural remedies to help with cavity pain. 1. Rub extracts on the tooth. One way to help relieve pain from a cavity is to use natural extracts. You can use vanilla, almond, peppermint or lemon extracts to relieve pain from a cavity. Soak a cotton ball in the extract, and then place the cotton ball on the tooth or gum where the ache is. Leave it there for around 10 minutes. You may also choose to put the extract on a Q-tip. 2. Try essential oils. Some essential oils have anti-inflammatory and antibacterial properties that can aid in pain relief. Try using sunflower oil, sesame oil, oregano oil, nutmeg oil, clove oil, or tea tree oil to stop cavity pain. You can place a few drops of the oil into a few tablespoons of the water and rinse your mouth out with the rinse. You can also put the oil on a cotton ball or Q-tip tip and rub the oil directly onto the sore gum or tooth. You may want to try packing a cotton ball soaked in one of the oils, particularly clove oil, into the cavity. Try not to get the oil anywhere else in your mouth because it could cause irritation. Make sure you don't swallow the essential oil. Always spit it out. 3. Chew leaves. Plantain and peppermint leaves have anti-inflammatory properties that can help relieve pain in your mouth. To use for tooth cavity pain, place the leaves in your mouth and chew for a few minutes to release the helpful juices. Then, move the leaves over to the sore gum or tooth and let it rest there for around 15 minutes. You may also choose to use dried peppermint leaves or peppermint tea. Plantains are backyard weeds that have healing properties. The plant is in almost every backyard. The leaves are easy to identify due to the long, vertical veins along the leaf. 4. Cover the sore area with citrus. You may be able to relieve cavity pain using fruit from your refrigerator. Lemons and limes may be able to stop tooth pain because of the citric acid and vitamin C, which have antibacterial properties. Cut the lemon or lime into slices. Then, bite into the slice to release juice into your mouth. Place the juice and the slice over your sore gum or tooth. 5. Make an apple cider vinegar rinse. Apple cider vinegar is used in many folk and home remedies for its antimicrobial properties. To make a rinse for your sore mouth, combine a quarter cup of warm water with 2 tablespoons of apple cider vinegar. Swish the solution in your mouth for 30 to 60 seconds. Make sure to swish it around the tooth with the cavity. Spit out the rinse and repeat 2 to 3 times. Rinse with warm water. You can do this 3 to 4 times a day, but do not swallow the water-vinegar mixture. Do not repeat the vinegar rinse for more than 4 days in a row. Vinegar contains acetic acid, which can erode the enamel surface, especially if you brush your teeth immediately after. 6. Bite into garlic, onion, or ginger. Garlic, onion, and ginger are known for their antimicrobial properties, which can help with cavity pain. Place a small piece of garlic, onion, or ginger in your mouth, directly over your painful tooth or gum area. Slowly bite down on the sliver, which will release the juice inside. This will relieve the pain by numbing the gums. 7. Try an asafoetida paste. Asafoetida is a plant known for its antimicrobial properties that is used in Middle Eastern traditional medicine. You can use this to make a paste to help with cavity pain. Combine 1/4 teaspoon of asafoetida powder with fresh lemon juice. Make sure to use enough lemon juice to make a thin, spreadable paste. Spread the paste on the cavity and around the gum. Leave it on for around 5 minutes. Rinse the paste from your mouth water. You can put the paste on your tooth 2 or 3 times each day.